It's the COVID-related news that many in the city had been expecting before. Now only the hard proof didn't come until today. The new individualized data that has come from public health shows that those people in our city's racialized and low-income communities have been hardest hit by the virus. Call it further proof of COVID colliding with systemic racism.
While COVID-19 has affected all of us, unfortunately, it has had a greater impact on those in our community who face greater health inequities.
After months of failing to collect race-based data during the COVID-19 pandemic, Toronto Public Health began to do so in May. And those numbers now show 83% of those with the virus are from a racialized group. 21% of COVID cases are people from the city's black community, while representing just 9% of the population. 20% of people infected identify as South Asian or Indo-Caribbean. On the other hand, 17% of Toronto's COVID cases are among white people, despite making up 48% of the population. A huge disparity.
COVID-19 discriminates. It exacerbates existing social and economic differences. Early in the pandemic, we were focused on flattening the curve, but there was less focus on who was under the curve.
This data once again shows us the magnitude of the task before us and just how much of a challenge this inequity represents to our shared collective values as Torontonians.
27% of the city's COVID cases are from households making less than $30,000 annually. Another 26% making from $30,000 to $50,000 per year, all considered low income. Compare that to those making $150,000 or more, where just 6% of COVID cases come from.
We've often talked about how we're all in this together. And I will tell you, to my core, in this city, in Toronto, I believe it. We are all in this together. But clearly, and the data shows this, we have more to do.
Mapping data released by the city in May showed that the neighborhoods with the highest infection rates have a higher percentage of minorities. Reflections of a problem much larger than the health pandemic being faced today and the need for deep-rooted, long-term solutions.
We need to focus on the social determinants of health, like affordable housing opportunities, access to employment and income supports, and educational opportunities. And yes, we need to address systemic racism.
In the short term, pop-up testing has actually started to take place in some of those communities hardest hit, albeit only in the last few weeks. And the city says it has set up some isolation sites for those people who have tested positive for COVID but can't self-isolate at home because of their living conditions.